Welcome to our first class, online class. This class is only for the lungs, and our item card in the first card, the thorax card, the number 4 item, lung, pleura, trachea and bronchus. We will cover all the things in our today's lecture, and first of all we want to talk about the lung. Human body has two lungs, right lung and left lung, and these lungs has some features like surface, borders, margin, and these lungs are connected with each other through a trachea, and this trachea has two bronchuses. First of all, if we want to know the lung in detail, then we can make the borders of the lung. Lung has 3 borders. This is the inferior border, this is the anterior border, and there is a posterior border. And lung has 2 surfaces, the costal surface and the mediastinal surface. And lung has 2 important things of the lung is the apex and the base. This is the lung, and this is the costal surface, and this is the diaphragmatic surface. One important thing is that if we describe the borders of the lung, when the anterior border, if we want to describe the anterior border of the lung, then we can see that there is a notch in the left lung. First of all, you have to define one thing, that when we have our own side in the anatomy, when we learn a viscera, we explain it from the in front, then we have to define the side. We have to determine the side. This is one lung, this is another lung. If we want to determine the side, then it will be the left lung, and it will be the right lung. This left means this is left. That means it is in front of your right hand, and it is in front of your left hand, so that it is the right. So in the anterior border of the left lung, you can see that there is a lingula in the anterior border. There is a lingula in the anterior border. Lingula means there is a carp. There is a carp in the anterior border, that is called the cardiac notch. This is the cardiac notch. So these are the surface. This is the costal surface. This is the mediastinal. This is the diaphragmatic surface. These are the surface, and lung has some lobes. We can see some lobes, that lung is divided through the lobe, right lobe and left lobe, right lung and left lung. This is which lung is this? In front of your left hand, this is the left hand. In front of your left hand, that is the right lung. If we examine the right lung very closely, we can see that there are 2 fissures. There is an oblique fissure and there is a horizontal fissure. This oblique fissure and horizontal fissure divides the lung into the 3 lobes. This is the superior lobe, this is the inferior lobe, and there is, I think this is the posterior lobe. Right lung has horizontal fissure, separate the. So this is the lower lobe, and this is the upper lobe, this is the middle lobe. In the right lung, we have 3 lobes, lower lobe, this is the lower lobe, this is the upper lobe, and this is the middle lobe. And in the left lung, we have a single fissure, and it divides the upper lobe and the lower lobe. This is single fissure. But there is a cardiac notch, and this elevated part is known as the lingula, tongue-like structure. And this is the posterior surface of the lung. Posterior of the lung, we see that the oblique fissure. This is the right lung, and this is the left lung. From the posterior, this is the right lung. This is the oblique fissure, and this is the horizontal fissure, and this is the oblique fissure of the left lung. This is the right lung. Now this is the right lung. So these are the fissures of the lung. External feature, border surface. External feature, border surface, all the things of the lung, very preliminary thing, and we want to talk more details after a few minutes. Now we want to talk something about pleura. Pleura is a very difficult thing. There is no images in your books or other areas, so that it is very much difficult to explain. But I am trying to explain you that in this image you can see that the lung. Here is the lung. Here is the systole. There is a space in between lung and the systole. And this space is the systole, and this is this surface of the systole. There is a glistering surface, and there is in the lung there is a glistering surface. So these two surfaces is covered by the pleura. This is the pleura. This pleura is the visceral pleura, and this pleura is the parietal pleura. We can see it more detail in the in this video. We can see this is the systole, medial side of the systole, and this is the parietal pleura, and here is the visceral pleura. We can see if we deflate the lung, we can see that this goes down, and this is the visceral pleura. The pleura has some potential cavities that is significantly important. This is the, if we explain the pleura, this is the pleura, and pleura has the same thing. This is the mediastinal surface, this is the costal surface, and this is the diaphragmatic surface. And when the two surfaces meets each other, then there is the races. This is very much important in clinical area. This surface is the diaphragmatic surface, and this surface is the costal surface. So there is a angle in between the costal surface and the diaphragmatic surface. There is the costo-diaphragmatic races. This is known as the costo-diaphragmatic races. This is the diaphragmatic surface, and this is the costal. So costo-diaphragmatic races, and there is another race here. So what will be the name? This is the mediastinal area, and this is the diaphragmatic area. So this race will be the these races is known as the mediastino or diaphragmatic, but it is not hearing sound, so then it is known as the cardiophrenic races, costo-diaphragmatic races, and the costo-mediastinal. This is the costo-mediastinal races, costo-mediastinal. So which one is the costo-mediastinal? So this is the mediastinal, and this is the diaphragmatic. In our two-dimensional view, it is the diaphragmatic surface, but in the three-dimensional view, this mediastinal pleura makes an angle with the costal pleura. Then it is in this figure you can see that there is the mediastinal pleura, and this is the costal pleura. This costal pleura and the mediastinal pleura makes the costo-mediastinal races. This is the costo-mediastinal races, and this is the and this angle, I think it known as the cardiophrenic angle. It might be the wrong, but I think this might be the idea. So these are the pleural cavity, and the some important in this pleural cavity, clinical importance in the pleural cavity, that sometimes fluid may accumulate into the pleural space. Then there is a clinical condition that is known as the pleural effusion. So when there is the pleural effusion that can accommodate fluid within the pleural space, normally there is a tiny amount of fluid that accumulates into the pleural space, tiny amount of fluid. When this fluid becomes more and pathological accumulation, that known as the pleural effusion. So this is the pleura and the pleura. This is all about the pleura. Now we want to go through the another thing of the lung, that is the hilum of the lung. That is the mediastinal surface of the lung. This is the mediastinal surface of the lung. This is the mediastinal of the. So now I want to ask you which lung this is and which lung that is. Yes, you are right. This is the left lung and this is the right lung. These lungs are connected with the trachea. This is the trachea through the bronchus. This is the bronchus. This is the left bronchus. This is the right bronchus. The area where there is entry of the bronchus into the lung, this is known as the root of the lung or hilum of the lung. This area is devoid of the pleura. So in this area there are so many structures. Sometimes it is asked in your examination that what are the structure passed through the root of the lung into the hilum. So root of the lung, there is the trachea. You can see this is the trachea. That means the bronchus. This is the left bronchus. This is the right bronchus. And there is a dark area. This is the pulmonary artery. This is the left pulmonary artery, and this is the right pulmonary artery. It enters into the lung, pulmonary artery. Then this is the trachea, and in between there is a dark area. That is the pulmonary vein. Do you know how many veins, how many pulmonary veins have in each lung? Yes, that is 2 pulmonary veins. This is one pulmonary vein. This is the upper pulmonary vein. This is the lower pulmonary vein. 2 pulmonary veins in each lung, and in the right side we can see that there is the pulmonary artery, and this is the pulmonary vein. It is the one pulmonary vein. There is another pulmonary vein. So if someone asks you what are the structure passed through the hilum, in the largest, in the broad scale, you can name these structures. That is the pulmonary artery, and the bronchus, principal bronchus. This is the pulmonary veins, and there is another structure of the pulmonary bronchial artery, and some lymph nodes and lymphatics that can come through this through the hilum. So this is the hilum of the lung, and there is another structure you can see. Next we will discuss this. That is the esophagus, and this is the diaphragm. And we can see something about the trachea. This is the trachea. Trachea is a windpipe through which the air enters into the lung. And trachea divides into the bronchus. This is the left bronchus. This is the right bronchus. This bronchus divide into the secondary bronchus. In the right side, you can see that there is the bifurcation of the bronchus. This bifurcation is known as epi. It is known as this is epiarterial bronchus, and this is the hypoarterial bronchus. In between, the pulmonary runs. So above the pulmonary, below the pulmonary. Then the bronchus divides into so many parts. The tracheobronchial tree, we will see later. You can see the structure of the trachea. The structure of the trachea, there is a cartilage. This cartilage C-shape, and there is dehiscence of the cartilage. There is smooth muscle of the trachea. This is the, and there is the main bronchus in this bifurcation. So these are the something about the lungs, trachea, and the pleura. Now we want to tell something about the vascular supply, nervous supply, and the lymphatic drainage of the lungs. Here we can see arterial supply. Now arterial supply of the lungs. The lung is supplied by two types of arteries, and that means the conductive portion of the lung, the area where there is some conduction of the air, that is supplied by the conductive portion is supplied by the bronchial arteries. Bronchial artery, you can see here in very close up view, you can see here that this is the descending aorta, this is the arch of aorta, this is the descending aorta. This is descending aorta has a branch. This is the left bronchial artery. This is the left bronchial artery. This left bronchial artery supplies the conductive bronchial tree within the lung. And in the right side there is the right bronchial artery. And the origin of the right bronchial artery from the third intercostal artery. Third posterior intercostal artery. From the third posterior intercostal artery there is the right bronchial artery, and in the left side it is from the descending aorta. This is the main supply of the conductive portion of the lungs, and the respiratory portion where there is the air exchange occur. There is the pulmonary trunk divides into the pulmonary artery. This pulmonary artery goes into the alveolus, and there is some exchange. And the venous drainage of the lung is through the bronchial vein. In the right side, the bronchial vein drain into the esophagus vein, and left side the bronchial vein drain into the hemiesophagus vein. And the exchange part of the lung, the venous drainage sometimes through the that portion is drained by the pulmonary veins. These are the venous drainage and the arterial supply of the lung. Now we can go through the lymphatic drainage of the lung. This is the lung. This lung has the peripheral area, and there is some central area. In the peripheral area there is some small lymphatics. There is the superficial lymphatics, and deep area there is the deep lymphatics. So when there is the question of the lymphatic drainage, then it should be mentioned that the superficial drainage system and the deep drainage system. Superficial drainage system, in the superficial part of the lung, the lymphatics, the lymph are collected through the lymphatics, and then finally they drain into the bronchopulmonary or hilar lymph nodes. Finally they enter into the hilar lymph nodes. And in the deep part of the lung, there is some intrapulmonary lymph nodes, intrapulmonary lymph nodes. These are the intrapulmonary lymph nodes. From these lymph nodes, the lymphatics drain into the bronchopulmonary or hilar lymph nodes. These hilar lymph nodes. From these hilar lymph nodes, they go more proximally, and the tracheobronchial lymph node. From this tracheobronchial lymph node, they go through the paratracheal lymph node, and finally they drain into the in the right side. They drain into the this is the they drain into the brachiocephalic vein. Finally, all the lymphs drain into the vein, that is the brachiocephalic vein. Through this they go into the to the right atrium, all the things. And these are the lymphatic drainage of the lung. And now we go to some points of the nerve supply. Nerve supply, the lung is supplied by the lung, and the tracheobronchial tree is supplied by the sympathetic and the parasympathetic. You know, the sympathetic part of the nervous system is the thoracolumbar outflow, and the parasympathetic is the craniosacral outflow. In the thoracolumbar outflow, the part of the thoracic 1 to thoracic 5 segment of the spinal cord, from the lateral horn of that spinal cord, the sympathetic nerve fiber comes out, and they supply they form the pulmonary plexus, the anterior plexus, posterior plexus. There are so many plexuses. In this plexus, there is another part of the nervous system, that is the parasympathetic nervous system. It comes from the vagus nerve, the 10th cranial nerve, vagus nerve. It comes from here and forms the pulmonary plexuses, and it mainly supplies this tracheobronchial tree. In the tracheobronchial tree, you have seen that in the tracheobronchial tree, in the trachea there is the C-shaped ring here. Here is the cartilage, and there is the smooth muscle. Smooth muscle is the muscle. Smooth muscle is the muscle that is not controlled by our will. We cannot intentionally or voluntarily, we cannot control that muscles. That is controlled autonomously. That means autonomic nervous system controls these smooth muscles. So autonomic nervous system has two parts. One part is sympathetic and another part is parasympathetic. So now question is, if we stimulate the sympathetic branch of the autonomic nervous system, what will be the result? Is there contraction of the smooth muscle or relaxation of the smooth muscle? That is your question. Try yourself. When there is the sympathetic stimulation, that there is a crazy dog running towards you, and you get fear. You have a fear. And then you need how many air into your lung, more or less? I think when we run in fear or any purpose, then there is extra work in our body, so we need extra air. If we need extra air, then we have to dilate this. We have to dilate this tracheal ring. This tracheal ring. We have to dilate this tracheal ring. And the sympathetic stimulation of this smooth muscle causes the relaxation, so that it can get wide. And when there is the parasympathetic, we need less oxygen, then it contracts. So the action of the sympathetic nervous system is the relaxation of the smooth muscle of the trachea, and the activation of the parasympathetic nervous system causes contraction of the smooth muscle of the trachea. And there is another thing we want to discuss, last thing, and very much important thing about the lung, that is the bronchopulmonary segment. For the bronchopulmonary segment, for the understanding of the bronchopulmonary segment, we have to understand the bronchial tree. This is the trachea. This is the trachea. This trachea divides into the bronchus. This is the primary bronchus or main bronchus. This is the primary bronchus. Then this primary bronchus divides into the secondary bronchus. This secondary bronchus divides into the tertiary bronchus. This tertiary bronchus finally divides into the segmental bronchus. This is the segmental bronchus. These are the segmental bronchus. So these are the segmental bronchus. So primary bronchus, secondary bronchus, then tertiary bronchus, and finally the segmental bronchus. The area of the lung that is supplied by the So we can see this picture. This is the colorful picture where there is the primary, and this is the primary, this is the secondary, there is tertiary, and finally the segmental bronchus. The area of the lung that is supplied by single segmental bronchus is known as the bronchopulmonary segment. So each lung has some bronchopulmonary segments. That in the right side there is the superior lobe. This superior lobe has 3 bronchopulmonary segments, middle lobe has 2, and the inferior lobe has 4. Inferior lobe has 4 bronchopulmonary segment. So this bronchopulmonary segment is the area that is supplied by single tertiary bronchiole, single segmental bronchiole. So this is the superior lobe of the right lung has the apical and the anterior and the posterior bronchopulmonary segments. In the left side, the superior lobe has the anterior, posterior, anterior, and the superior lingual, inferior lingual. There are so many segments in this area, and you can read this from your book. But it is clinically very much important that this area is supplied by a single bronchiole, that is segmental bronchiole. If there is any disease, that means infectious disease that passes through this bronchiole, that means tuberculosis or something, any respiratory infection that comes through this bronchiole, that will distribute only through this area. So if there is infection in this segment, and we have to intervene this with surgical intervention, then we can remove this part, only this part. And this is important thing, that this bronchopulmonary segment has a bronchiole, that is the segmental bronchiole, and this bronchiole is accompanied with the artery, bronchial artery, but vein is the bronchial vein remains in between these 2 segments, intersegmental area. So if you want to do surgery, your guide is the vein. You have to follow the vein, and artery follows the bronchial segments. So this is about the bronchopulmonary segment of the lung. And finally, thank you all accompanying me, and all about the number 4 item, that is the lung, pleura, trachea, and the bronchus. All thing here. Thank you all.